Hi, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today I am really excited to dive into a partnership that's formed between these two gentlemen and their respective companies. So please join me in welcoming the CEO of Rightway, Jordan Feldman, and the co-founder and CEO of Mark Cuban Cost Plus Drug Company, Alex Oshmyansky. It's great to have you guys here.
Thanks,
Hey,
Jessica.
thanks for having us.
And so you guys have entered into a partnership agreement that to me is pretty revolutionary. So this is, if I'm understanding this correctly, this is the first time that a PBM has integrated with a generic pharmacy manufacturing company to provide and actually encourage its members to go generic first. Do I have that right? Yes? Jordan, why don't we start with you and talk a little bit about this partnership and what it really means for the members that you have on Rightway?
Yeah, thanks, Jessica. And we're excited to talk about this new partnership that we have live and that our members are really benefiting from today. But when we built Rightway, we wanted to fundamentally dismantle the legacy PBM model that's full of misaligned interests, that's full of vertically integrated and almost monopolistic type entities, and really take a fresh approach to what it means to be a PBM. And when we architected Rightway in this new to the world model, everything really needed to look and feel different. And in doing that, we looked for partnerships that could really help compound this advantage, that could really take what it means to be a PBM to the next level. And as part of this kind of new to the world, member-centric PBM focused on lowest net cost, we wanted to find partners that could really help us achieve this. And, at Rightway, we don't own our own mail order. We don't own our own specialty pharmacies. We look to have a network of competitive offerings that we can give to the employer clients that we work with. And as part of that, the Mark Cuban Cost Plus Drug Company was a perfect fit. We don't take rebates. We don't have any incentive to play any of the games and gimmicks that the traditional PBMs do. So when Alex and team came along, we looked at this as a lever that we could pull to really help reduce the cost of prescription drugs for our members and really do it in an innovative, tech-driven way. So with Alex and his team's platform, we have real-time insight into that lowest net cost pricing. We're able to push members via our technology and via our app and really elevate these opportunities to help members save money. So across everything we're trying to do as a PBM, what Mark Cuban Cost Plus Drug Company is delivering to the marketplace is so complementary and so aligned with the really innovative delivery model that we have in the PBM space. So we're super excited.
Jordan, I'm excited for you, and I don't think I'm not coming back to ask about this extra effort on the PBM side of things, because I met you as a care navigator first, and then it kind of morphed into a PBM, and now it's so PBM forward. So I'm coming back for this. Do not think you're off the hook. But before we get there, Alex, okay, first of all, welcome, because I think Mark Cuban Cost Plus Drug Company is probably one of the most exciting companies that is launched this year. I mean, if not in a long time, because of the commitment that you have in your mission to really disrupt pharma and really beat them, when it comes to price, which I think is something that's been long overdue. So welcome, and it's a pleasure to have you. I want to ask about the Rightway partnership right off the bat. Why partner with them first? I mean, this is an interesting move, particularly as you guys, are in your first year of business.
Yeah, no, absolutely. And for us, it's all about transparency. It's making sure that we can get, our prices to patients or to payers at what the actual prices are. So, as part of our arrangement, as Jordan was saying, there's no spread pricing. There are no rebate dollars. The price that Rightway's clients are paying are the price that's listed on our website. And I think multiple independent consultants, academics at this point have found that I think there was a study that came out from the Harvard School of Public Health / Harvard Medical School a few months ago that found we would save Medicare Part D plans between 30 to 40% on their generic drug spend with our model. Independent consultants have found for commercial plans that's more along the lines of 50 to 60% on their generic drug spend. So yeah, just cutting out those layers of obfuscation and passing along the true prices of the products is really what drives savings, cutting out all these layers of pathologic intermediaries and Rightway was the perfect partner, given their, focus on transparency and driving value to their clients. Was thrilled when we got connected, and really excited about our partnership going forward.
All right, Jordan, I've got to ask, I'm asking about that PBM side of things, because it seemed almost like this really was the breakout product side of Rightway this year, really advancing your position in that market. I was actually almost surprised when I read the press release about this partnership, that it's like Rightway was talked about as a PBM, and leaving the care navigation piece out of it at all. So what can you tell us about how your model is changing, what you're hearing from your customers about where they want to focus on cutting costs? I mean, it might be kind of obvious, but I want to hear what you're hearing. And I want to hear about the care navigation business, and if that's gone away, or if that's still a way to make the PBM side of things work.
Yeah, so it's never about leaving the care navigation piece out. Our focus as a company is all around the member. It's how do we create the best, the most dynamic, the most tech-driven experience to really help our members have better healthcare experience, generate better outcomes, and lower cost. And as we were working in this very privileged position with our members around their care navigation, helping them understand where to go and what to do and how to get there, we started learning a lot about where their friction points were, where they were spending inefficiently, where they weren't getting the right sort of care and suboptimal outcomes. And it was mostly around that pharmacy benefit experience where there wasn't a lot we could do. You can't optimize a broken system. The big three PBMs, they're fundamentally broken. They're backwards. They have no alignment or interest with the underlying member. So there was nothing we could do as a care navigation platform to really help members around what's now 30% of their total healthcare cost in the pharmacy benefit. So, we looked at that and said we needed to build something there. We couldn't just optimize this broken system. And that's how and why we built the PBM. But care navigation is really the chassis which all of this sits around. And we want to make sure that we're harmonizing across medical and pharmacy. And by having the PBM, pharmacy's the best opportunity to engage members around their health and healthcare. It's the most frequently used benefit. So we looked at that. We looked at the cost savings opportunity and said this needs to be a pillar that we're delivering to the market and helping our clients around. But it's ultimately how care navigation and pharmacy benefits converge that we believe creates the best outcome, the best experience for our members.
With your clients, are you able to offer each one independently, both of them together? And can you give us some insight on your mix?
Yeah, so, it's modular. We started in the care navigation space, and we have over 1,500 employer clients just on the care navigation platform, and that's that doctor and the family. We now have over 100 employer clients on our PBM standalone, and we'll have about 100 clients on the combined version. And what we see when clients take care navigation plus PBM is better member experiences, more engagement, more utilization of the ecosystem, and ultimately higher or a greater ability to impact healthcare costs. So, we have that modularity, we have that flexibility, which we think a lot of our clients appreciate, but we're starting to see a lot of clients say, hey, we want to do this together. And that's ultimately where this is going.
All right, Alex, what can you share with us about your business? How is going? You're almost a year in. I mean, I've read some numbers of patients that you guys are working with, and I'm seeing numbers like in the millions. So, I mean, what can you share with us about the growth of Mark Cuban Cost Plus Drug Company in its first year?
Oh yeah, so it was a little over 10 months since we launched the company on January 19th, or at least launched one component of the company. So to give a sort of holistic picture of what we're up to, I like to say we're building a parallel supply chain. And what does that actually mean? So true to our name, Mark Cuban Cost Plus Drug Company, we are building a pharmaceutical manufacturing plant here in Dallas, Texas, across the street from me. And that, after 3 years of construction, is almost done. So sterile fill finish facility, very focused on producing shortage drug products that go up dramatically in price when they are on shortage. And just with everything we do, that'll be done on a cost plus basis. So we'll reveal publicly what our costs are, and at a flat 15% markup on top of that, and hopefully, talking to hospitals now, and hopefully we'll have those products early shipping out early to mid portion of next year. So that's going well. But we very quickly realized that it's not enough just to be a pharmaceutical manufacturer, because wholesalers are under no obligation to purchase your products. PBMs are under no obligation to put them on your formulary. So we decided to build out basically all of that infrastructure. So we are a registered pharmaceutical wholesaler in all 50 states. At the moment, we use that ability primarily to wholesale to ourselves, and what has caught by far the most public attention since it launched earlier this year, our direct-to-consumer mail-order pharmacy, where we revealed the price that we purchased at wholesale. We had a flat 15% markup, $3 fee to pay for our pharmacy partners at TruePill, who do the fulfillment for us, and $5 per order shipping and handling, and that's our total cost. And yeah, that part of the business has seen very robust growth. We've been growing pretty steadily, 30 to 40% month over month on pretty much every metric we have. Right now, I just checked, I think we're up to 1.4 million folks have signed up for accounts on our site. And yeah, it's been a whirlwind trying to keep up. It's been going, it sounds like just something you say, but sincerely, it's grown much faster than we anticipated. When we launched, we have a number of ultra high cost generic products on our site, imatinib, colchicine, mesalamine, where our prices are dramatically less expensive than conventional market access channels. And we thought, we were basically setting up the pharmacy as a public service to help those patients. And, it is very popular amongst the patients who need the ultra high cost generics. But, living in this space, I think something we lost perspective of is, how much patients are getting ripped off even on their very common medications. One of our most popular medications at launch was rosuvastatin, generic Crestor, which, is pretty much available, cheaply if you ask for a cash price anywhere. So we were like, why is this so popular? And it turned out one of the major PBMs was adjudicating it at $200 for a month's supply. So if you naively just walked into, a Walgreens or any local pharmacy and showed your PBM card, you'd be asked, and you had a high deductible plan, you'd be asked to pay, $200 for that month's supply. So really, this is the first time patients were learning that, because of our celebrity spokesperson, that an alternative existed. And yeah, it's really blown up in ways we couldn't have anticipated. So yeah, very robust growth there. And yeah, on top of that, beginning our work with companies like Rightway to provide employer benefit solutions. So not only individual patients, which of course is always our priority, but also payers and self-insured employers, insurance companies can take advantage of our pricing to drive savings as well.
I love it. My God, that is a whirlwind. I need a plant tour, Alex, when this is complete. Please put me on the list.
Sure, come on down. Yeah.
That'd be great. All right, so I want to ask a little bit, actually, both of you. One of the things that really strikes me in listening to both of you and how your business models are evolving and continue to evolve is that it seems like there's a lot of just lip service out there about working to serve the healthcare consumer, but the healthcare consumer has traditionally just been so disintermediated from their dollar that it feels like even those that really mean well and want to help serve them, it's like it's not resonating. And Alex, I love what you said, that your celebrity spokesperson helped create awareness for a different type of avenue for getting generic drugs in a market that maybe would not have even thought about it or heard about it. I'm curious to hear a little bit more, and Jordan, I'll start with you, just about like this whole idea of kind of fighting for the healthcare consumer's dollar in a different way. Because listening to both of you, and I know both of you, I mean, Alex, you're out to disrupt pharma. Jordan, you're out to disrupt the PBM. I mean, these are not easy things. I'm curious about what do you see as the next big thing for you guys, the next most immediate thing, not, down the road, but or high in the sky, but like the next most important thing that needs to be done in order to really, help fight the fight for that healthcare consumer and that control over their dollar and their spend.
Yeah, well, look, we are in a monumental inflection point in the pharmacy benefit space, and a lot of that is being driven by the consumer. And you only have to look at the inflationary environment we're in to really understand just how disadvantaged that consumer is in this marketplace, whether it's gas or groceries or pharmacy benefits. They're tired, they're frustrated, they're fed up, and they're ready to do something about it. And a lot of this momentum started with GoodRx when they were able to, deliver a consumer-facing app that gave you some pricing information. That was kind of V1 of this awareness. And I think what Alex and his team have really been able to do is to turbocharge that. And we have to make pharmacy benefits deflationary. We can't keep looking at the cost of pharmacy benefits at the enterprise level, at the consumer level, and seeing double-digit compounding increases in cost. It's untenable and not sustainable. So, this is a really interesting movement that's starting bottoms up with the consumer, where they're going to their HR team, they're going to their CFO and saying, why can I get a cheaper prescription drug on this cash pay service than I can with my pharmacy benefit that I'm paying $1,000 a month for? And they're frustrated. They're tired of this nonsense and the games and gimmicks and this borderline criminal behavior that the big three PBMs have operated under for the last 3 decades. And now all of a sudden we can do something about it because there are great alternatives. And I think, as we move towards this inflection point, this notion of conservatism around pharmacy benefits, where you have to use one of the big three PBMs, is changing. And it's changing because it has to, because of the member experience and cost. And I think we can get into, how we're doing that. But that's really.
Every time you say inflection point, my heart beats a little faster. I'm like actually really excited to see this model change. And I'm curious, what are you looking at as some of like the signs that we have hit that inflection point? And Alex, I want to hear the same thing from you, but Jordan, kick us off.
Look, I think if you look at the arc of innovation in any other industry, you hit these points where conservatism goes by the wayside for real innovation and real advancement in an industry that's typically been bogged down by a monopolistic type behavior. You've seen this in cloud computing, you've seen it in the car industry, where kind of enough is enough, and you have to have a next best alternative for that to be a reality. And I think both some of the consumer trends we just talked about, but a lot of these benefits leaders and CHROs and CFOs are all of a sudden looking at their income statement and seeing pharmacy benefits go up 10, 15, 20% every year. And they're taking a step back and they're talking to their consultant about what are the alternatives. And historically, they weren't great. The pharmacy benefit alternatives, they were transparent, but that just meant they didn't get better unit economics. They didn't get competitive cost of goods. So they used transparency as a lever. But, now as a lowest net cost approach and a way to sustainably and repeatedly reduce the cost of pharmacy benefits, we can do that. And it's through partnerships like we have with Mark Cuban Cost Plus Drugs that we're able to do that. So it's this steady drumbeat of just frustration. And at the same time, the big three PBMs are becoming more powerful, and they're not playing ball. And it's going to change. And it's going to change in a bit of a watershed moment over the next 1 to 2 years because of what's going on in the macro, right? Over the last decade or two, people weren't as cost sensitive because we were in a bit of a bull run. As we see, 9% CPI and double-digit inflation, everyone is taking a step back and saying, what levers do we have to cut costs that aren't personnel? And better than any other lever within the healthcare ecosystem, pharmacy benefits can be reduced by 20%. And that's a massive amount of savings.
Yeah, they see Mark Cuban and Alex Oshmyansky coming, and they're like, this is a much better alternative. Alex, what are you looking at? Do you agree, first of all, that we are at this inflection point on that PBM model? And if yes or no, I mean, what signs are you looking at, the signal fire there?
Yeah, no, I would agree. I think basically the status quo cannot hold. And, I think people are realizing, why are, our pharmaceutical costs as a country are twice that of, any other developed nation. Why? And, the PBMs are meant to be negotiating on our behalf. So there's only two explanations. Either one, they're terrible negotiators, or there's something fishy happening. And, you know, I'll leave it to the audience to decide which. But, you know, the fact that we're paying so much for effectively nothing, you know, I think it sort of crept up on us as a society, but right now it's so extreme that, you know, the status quo just cannot hold. And, you know, people ask me all the time, like, you know, there doesn't seem to be anything innovative about what you're doing. There have been cash pay for pharmaceuticals before. And I'm like, correct. There's nothing innovative about what we're doing. We want to just go back to retail. Like, we want to buy a product, mark it up a little bit, and then sell it again. Like, and the fact that we're so disconnected from that, and that there are so many intermediary layers, you know, everything from, you know, sourcing organizations like Claris One and Red Oak, the big wholesalers, the PBMs, the rebate aggregators. There are so many layers that disconnect, you know, people from the actual price of the pharmaceutical. And I think they're beginning to realize, you know, if there are like 6 layers, you know, PSAOs, all this nonsense, which is marking up the cost of the drugs. You know, Adam Fine's famous slide of how money flows in the pharmaceutical industry, you know, with an arrow between each actor, and it just looks like a pot of spaghetti. Like, you know, in terms of like, where can we, you know, add value to the ecosystem, save people money? And, you know, I think part of the way we look at it is, you know, I don't consider, you know, people who sign up for our site to be consumers. You know, my background, I'm a physician. I consider them to be patients, and it's my job to do right by our patients. And yeah, that's what we try to do.
Well, I love the simplicity of your cost plus equation. I mean, there's beauty in that, but I have to play devil's advocate and just ask you guys both, in terms of scaling up both of your businesses. I mean, what happens if the PBMs, one of the big three, just decides to, you know, do something similar? I mean, Jordan, how does that impact you? And Alex, I mean, what happens if somebody else comes into manufacturing generic, you know, pharmaceuticals, and they're offering a competitive price too? I mean, I know the total addressable market here is massive, so it's going to take a while before it makes an impact on you. But in terms of scaling in the near term, any concerns about that? And what would you say to those that might ask that question? Jordan, let's kick it off with you.
Yeah, look, the big 3 PBMs have no incentive to reduce the cost of pharmacy benefits, plain and simple. You know, they operate all of these monopolistic tendencies. They own their own mail order. They own their own specialty. They, in some cases, own their own retail. So all they want to do is fill these different factories to the advantage of them and them alone. So, you know, there are a lot of levers that are idealistic that the big 3, in theory, over the last few decades, could have rolled out to reduce the cost of pharmacy benefits, but they haven't and they won't. You know, they have the classic innovators dilemma. They're publicly traded companies. They're sitting there with, you know, quarterly earnings every 90 days, and they can't adjust. They can't tweak this model. It's one of the most beautiful money-making models in the history of capitalism. And that's what they've created. And it's benefiting only the big 3 PBMs. So, you know, we could get idealistic about that. In terms of scale, look, we view ourselves as a technology company, and technology has the ability to scale in ways that some of these legacy models, you know, can't and won't. So we don't worry about our ability to execute at scale. And in fact, we've shown an ability to do that with over the 1.5 million members that are already on the Rightway platform, and the different levers we have to be able to service them with high net promoter scores, high user satisfaction, and downstream impact.
All right, Alex, what about you in scaling? I was part of a predictions webinar at the beginning of this year, and my wild and crazy prediction was that Amazon was going to acquire Teva and start manufacturing its own generics. If this crazy thing should happen, I've got a couple weeks left here. If this crazy thing should happen, what happens to Mark Cuban cost plus drug company? I mean, how do you continue to scale if somebody big like that enters into the space, or if one of the big pharma companies decides to just offshoot? I mean, how do you remain competitive?
Oh, sure. You know, I think Mark is fond of saying, you know, our product really isn't pharmaceuticals, it's trust. And yeah, that's the bedrock of our company is, you know, trying to be as honest and transparent in all of our business practices as we possibly can. So yeah, I think it's building that reputation, yeah, to keep going forward.
And,
I love
and
it.
that's
Well,
why we feel so aligned with Alex and team, right? All of the rebates, all of the spread pricing, we're not in the game of that. That flow of funds chart that Alex was alluding to, we have one transparent revenue stream, and that's our per member per month admin fee. We want to take the practice of a PBM and make it a technology company, a service platform. It's a critically important service that PBMs provide, right? Connecting drug manufacturers to employers, to retail, to mail order, to everything in between. But it doesn't earn them the right to take a little bit of everything along the way and to actually be misaligned with the consumer and the employer. So we charge one transparent admin fee. We don't take any other dollars. We take all of those other dollars that are sloshing around the system and give them directly back to the employer. And that's auditable down to a claim level.
I love that.
Yeah.
You know, go ahead, Alex.
Oh no, and I was just going to say more broadly, if other actors want to emulate us and follow our transparency model, God bless. Like more the merrier. Like
No, right?
we're focused on public health and social benefit, and if we are the spark that ignites a change in the system as a whole, go for it. Obviously we want to be profitable, we want to be sustainable, but more important is helping save and improve people's lives. So if we can accomplish that through systemic change, sweet.
It sounds like you've got this, the duality of that purpose is doing really well with both of your organizations. And like I said at the beginning, when I saw the press release for this partnership announcement, this kind of really, it made my heart skip a beat. Again, the inflection point here and the PBM pharma model, I'm glad to see that it's really starting to make some meaningful change. And I'm happy to hear what you two are looking at specifically as signs of the fact that, yeah, this is like a whole new era in terms of the pharmacy manufacturer PBM relationship. And I'm excited to see where this takes us. Hopefully it puts more dollars in people's pockets and continues to get patients what they need in order to be well. Thank you guys for joining me. It's a pleasure to talk with you both. Thanks again for stopping by. I'm Jessica DeMassa, and for more interviews with the who's who of health tech as they are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. Talk to you guys real soon. Thanks again, Alex and Jordan. Talk to you. Bye.
Thank you so much.